Yo, yo, yo. Welcome back to another awesome edition of the Best Practices Show podcast. Have you ever thought to yourself, I want everything to work? It should work all the time. Why doesn't it work all the time? Well, today we bring in an awesome friend of mine and a great mentor, Dr. Jim Otten. And he shares that everything works until it doesn't, and how to think better as a dentist to enjoy a career in dentistry. So please listen up. I hope you guys enjoy it, and we'll see you soon. Guys, welcome back to the Best Practices Show podcast. You know what I get to do? I say this all the time. I get to hang out with really cool people who are great teachers, great mentors, great friends of mine, and they get to share their wisdom so that we pass it along to you to create a better practice and a better life. I always dreamed of a day where I'd get to do CE for a living. I'm not there yet, but if I could, I would have one of these guys on all the time. His name is Dr. Jim Otten, who's been a dear friend of mine for years and years and years and years and years.
Decades.
And decades. And he is also one of the critical people that leads global diagnosis education, which we're going to talk about later. And today we're going to be talking about everything works until it doesn't. Have you ever experienced that? Well, we're going to go into the mind of a master. And he's going to explain that. So, Jim, thanks for being on, brother. I really appreciate you.
Oh gosh, man. Yeah, we go back so many years when we were both kind of neophytes in this profession, and it's just so cool to see the growth and development and the different chapters and how they unfold. And it was funny, we had an audio problem earlier, and I thought, well, everything does work until it doesn't. Isn't that correct?
So true. So true.
And it was a great metaphor to start the conversation. But thanks so much for having me. This is a great honor, and it's so much fun to be with you always.
Hey, well, I enjoy this. And if you're listening, you guys will see Jim is a man that has seen a lot, and he's got some incredible wisdom. And I want to start here too, Jim, because we got a lot of young listeners now. We have quite a few dental students listening now. And so if I don't know who Jim Otten is, give us a little bio. Who are you?
Well, well, first I'm a major contrarian. Okay. So that's the first thing I have to tell you. Is that I've always been the outlier. I've always been the one asking the questions. Even in dental school, I got in trouble all the time. Well, how exactly does that work? And they just go, oh, just be quiet and do the work, and you'll get your degree. And so that's been the way it's been all my life. And my curiosity got me in a lot of trouble when I was young, but I turned it into something positive when I got older. So that's the first thing you need to know about me. In the dental profession, it took me about 5 years to figure out I didn't know what I was doing, that I knew enough coming out of dental school. I learned not to be dangerous, and that was about it. And so after about 5 years, I started thinking, well, why do some of these things work and why do they not work? I'm doing the same kind of treatment, the same patients, and some of them are having good outcomes and some of them not so good outcomes. And there's got to be more to this than just cutting preps and putting the ceramics on, or doing the restorations, or adding resins, and back then even doing amalgams, because some of it did well and some of it didn't, and doing it the same way. So I started asking those questions. That led me into a curiosity about more of the medical and diagnostic side of dentistry, which led me into facial pain, TM joint therapy, occlusion. Occlusion was always a mystery to me, and I had some great mentors along the way, even in dental school, that kind of clued me into the fact that there was more to it than just cusp and fossa relationships. And then I met Pete Dawson along the way, and Mark Piper very early. Studied with them, did all their curriculum. Jim McKee and I did that together, so we go back together. We were brothers throughout that whole experience. It was awesome. And so when I met Dr. Dawson, I started to realize, wow, I can think again as a dentist. I don't have to just do, because I was just doing and not getting much fulfillment. So I went on to become went on to finish the curriculum at Dawson, went to the Piper Institute, got to be good. Luckily had both of those people as mentors, Pete and Mark, and that was just a blessing. And I always tell people, look, you're not going to have those mentors unless you put yourself out there to have those mentors. You're dealt a good hand by being in their presence, but you got to play the hand. So I was asking Pete all the time. I was asking for advice. I was writing him notes and getting him, and asking him questions, calling him up sometimes. And after a while, he was a great teacher and he's a great mentor. So you put yourself out there so that you can be in contact with that, because it's a really, when you look back at it, it's a blessing to be in their presence. And you shouldn't waste that opportunity. Don't just sit in the back of the room. Be active. That led to the journey through the Pankey Institute, where I became a faculty member. I was a lead faculty member. I was curriculum development. I was a curriculum development coordinator. I was a provost. I was on the board. So a lot of very active participation at the Pankey Institute, and really was again a wonderful experience with Dr. Erwin Becker as one of my mentors. I was just lucky. Jim Kincaid, Mike McDivitt, all these people who were just really caring, wonderful teachers sort of fed into me. So that's what I'm doing now. I tried to put things in play, tried to, realize I was always dealt a good hand, but I had to play it. And then look back on some of the wonderful mentors I've had and still have, and trying to pass that on now. So in a nutshell, and not a very small nutshell, that's it.
Yeah. And you built a wonderful practice, incredible practice in Lawrence, Kansas, home of the KU Jayhawks. So,
Hawk Jock.
Absolutely.
Yeah, it was a wonderful experience. I'm at the end of the practice career now, which is interesting in itself. But 42 years is pretty much long enough to do anything, right? And you realize that you have other ways to give back, and that's kind of what we'll talk a little bit about. Been very, very fortunate, built a great practice, a great restorative practice. And now I've been able to transition it to someone who's very like-minded, who's going to take it to even a better level, already has. And that's just a marvelous thing.
I love it. And so today we're going to be talking about everything works until it doesn't.
That's it.
First, explain that. And then let's talk about why that's important to the journey of any dentist.
Well, it's important because we come out of dental school with a perfectionist mindset, and it's perpetuated in our profession by a lot of different things, right? It's perpetuated by a lot of myths that if you build this facility, they will come to you and you'll be successful. If you use this technique, you'll be successful. If you follow this protocol, if you go to this course, if you do this curriculum, you'll be successful. And everything works to some degree, but it doesn't at some point as well. And so what your mindset has to be is not in this perfectionism, like it's going to be, the outcome is going to be exactly the way you think it's going to be, but what do you learn along the way? How do you learn? Like Jack Nicklaus used to say when he played a whole round of golf in a competition, the 3 or 4 days they play, he only hit 2 shots pretty much the way he wanted. He missed everything well. And so our job is really to miss it well and realize that it doesn't matter, what you use, who you follow, what material, what clinician, what protocol you use. You're still dealing with people who have a certain amount of their own particular disease resistance and host response, and they're all going to be different. You can't take responsibility for that. That's not your responsibility. Your responsibility is to help them decline at the lowest rate possible. And that means that they're going to decline. It's going to fail. So I've always approached things, number one, with a healthy degree of skepticism, right? The idea that you could rely on a material or a facility or any number of things to be successful by itself is mythical. I mean, I remember when Dr. Dawson, for example, when we were studying inclusion, he'd say, if you could comfortably load test any patient, you could successfully equilibrate them. So I did. And sometimes it worked, and sometimes it didn't. It's because we didn't really know enough about the internal derangement. We didn't have the imaging available to us to understand more about the architecture of the joint, what was happening up there. Load testing was not as reliable a diagnostic quality as we thought. Now, it's a piece that's important, right? It's all pieces that fit together. If you want to be a fee-for-service dentistry, all you have to do is have that mindset. That's another myth. No, you've got to offer something of extraordinary value.
Right.
Set yourself apart. You can't do that. If you finish all your cases in centric relation, they'll be successful. Another myth. No, we don't even know hardly how to define centric relation, much less finish all of our cases there. Some you shouldn't, and some you should, but you have to learn how to differentiate that. So I always say, with that healthy degree of skepticism, you should think about it this way. Be a student, not an acolyte.
Okay.
No one has all the right answers. Everyone has a bit of information to help you move forward. And don't jump on every bandwagon, because there's too damn many bandwagons to jump on.
Right.
And you might find that you're on the wrong one.
Right.
Way too late down the road.
Right. Yeah, I think, and part of that skepticism is just asking questions. At the end of the day, everything you do has got to be a product of your own conclusions. And then I remember Rich Green said one time to me, and I didn't get it. He's like, what did he say? Don't be margarine, or don't be margarine. I'm like, what the heck does that mean? He's like, it's an imitation. Right. He said, you want to be you. So when you're down here absorbing all that, you're the greatest gift you can give yourself is take it all in, ask really good questions, and go back and be an authentic version, which I don't know anything about butter or margarine, but I'm older now and I understand what he was trying to tell me. I'm not the best student ever. It takes a couple tries, but you're exactly right.
There's a German philosopher, I can't remember who it was, that talked about, he told the story of a painter, an artistic painter. And this apprentice painter wanted to become a great painter. So he tried to copy the great painters. He tried to copy what Picasso did. And he bought all the brushes, all the tools, all the canvas, all the art supplies. He copied his studio. He copied his environment. He copied everything about that. But he forgot to paint. You've got to paint. And so, it's the same in dentistry. If you're trying to copy someone else, you can emulate characteristics and philosophies that you think that work for you. But if you're trying to copy someone else, you'll never find the right mix of things to unleash your creativity and your potential. You got to be you. Just be you, and do what you think is best for you. I always think, there was I can't remember who the writer was. I can't remember his name. He wrote The Legend of Stephen Pressfield. He wrote the Legend of Bagger Vance, the story about the golf caddy. And he said, he was talking about, trying to find his own way. And he said, I had to make a decision about what I wanted to write. He said, did I want to write what I wanted to write, or did I want to write all the crap that sells? And he said, it's a difficult choice. And it related to dentistry a lot too. Do you want to do the dentistry that you want to do, right, or do you want to do the crap that sells? The stuff that's easy to market, easy to do, generates income. And it's the same thing with writers. Sometimes the best written books are not the ones that sell. The ones that sell are maybe not the best written book. It's not the one you want to do, but you still have to have some income. And so you think about that in terms of dentistry. If you decide, for example, that you want to differentiate yourself, and you want to specialize, you want to become fee for service, you want to really build enormous value for your clients, you still have to feed the animal, right? You still have to feed the bulldog, you still have to feed the practice. So how do you do that? Well, he talked about it in writing the book that you want and writing the book that sells, and just trying to, if you think about it in two concentric circles that overlap, it's the part in the middle. How can you find that area right in the middle where those things overlap? And it's the same in dentistry. Can you have that overlap somewhere where you create value for what you want to do, but it still has the capacity to help your practice move forward.
Yeah. And one of the things that before we had a chance to hit the go button in helping me understand this, which is awesome, is not only with that skepticism and not shooting for perfect, be more focused on the outcomes, so can you explain that? What does that mean?
Right. So if we in our clinical practice don't allow, first of all, I think you have to really allow yourself time to think. As you get older and more, let's just say you're more vintage. You're an older vintage of yourself. You get to look back on things and you say, well, what worked well and what didn't work so well? I mean, Bill talks about this all the time. He says, people give you more latitude, and you get to be more skeptical. I tell him, that's wrong. I've been skeptical all my life. That's our difference. You waited too long. You were in academics, but yeah, you really want to have the mindset of giving yourself enough space in your work time to pay attention to the outcomes that you're getting. Why does this work? Because if you're the type of dentist that's looking at just the means to get somewhere, then you're going to miss the real essence and the real value in helping your patient move forward. Let's take the example of worn anterior teeth. There are a number of pundits out there that in the tooth model, more commodity type model of dentistry will say, oh, if you've got worn anterior teeth, you can just add composite to these and make them look better and charge X amount per tooth, and it could generate $100 and something thousand a year for you just by patching up these anterior teeth. The first question you should ask yourself when you've got worn anterior teeth is, why in the hell are the anterior teeth worn? And we had all kinds of philosophies about this, right?
Right. So
if you pay attention to outcomes, you're going to realize, well, it used to be when I added to those things, they just break them off again. Okay, so let's not do that again, maybe?
Right.
Flat forehead syndrome, right? Oh, what the hell, right? Let's not do that again. And try to figure out, well, why is this happening? Well, then the explanation goes to, well, they're in the way of their bite, right? They're in this pathway. And all deference to some of the great minds in dentistry, I thought that too. Well, people don't sit there and bang their teeth together so much as they wear them down to nothing. No, they're grinding on it. They're really putting effort into them. You got to think that this enamel is somewhere on the hardness scale between steel and titanium. You don't wear that stuff out. It's like rubbing two slabs of glass together. You don't wear that down until it's millions and millions of repetitions. So why are they doing it? You got to figure that out first. Because if you don't, and you're just looking at the teeth, you're going to miss the fact that they may have a significant occlusal issue. They probably have a significant airway issue, and you don't know how to sort that. If you don't know how to sort that out, you're not helping them. You're just pushing the problem down the road and maybe even making it worse. So pay attention to your outcomes. Why does it work in some people? And why does it not? Because everything eventually fails. That's the other mindset you have to have. It all fails at some point. I remember I was coming out of dental school. I was like, my goal is to do my crown and bridge so well that in my entire practice career, people will never have to replace these. There were a few that worked, but there were a bunch that didn't.
Right.
And it's because you can't control everything. But I started to pay attention, thinking, well, that was a dumb idea.
Right.
Why are they failing? Let's figure that out, so that what we're really doing is we're slowing the decline of the individual over time, right? How do I slow their decline to the lowest rate possible? And if you pay attention to the outcome and you learn from the failures, they don't have to be catastrophic failures, but why do they keep chipping this? Why does this happen? Then you start to look deeper and deeper, and you really start to pay attention to really what are the fundamental issues that are going on here, that you really can become a great diagnostician and really help them become healthier, not just fix their teeth.
Yeah. I love what you're saying too, Jim. That's a learning piece that all of us have to go through. I mean, ultimately, all of this fails at some point. Mm-hmm. And if some of it makes the long haul, great. You're going to fail at some point, but using that failure. And I the podcast before this, interviewing your partner, Bill, he's like, my favorite lecture now is my failures. I started with a few and now I've got so many of them. And as you learn from these failures, you start to reduce the failures or reduce the amount of time, or add, some longevity to it. You mitigate some risk along the way. And I think what you're really saying is just be open and learning as you get older. You never figure this all out. No, you got to be open.
It's this journey. And what you have to realize is that through every one of those failures, you at least became a little bit better. That's the key. If you can become a little bit better, you can become a little bit better diagnostician. You can become a better historian, essentially, in understanding the patient that you're dealing with. If you can become a better practitioner in a sense of organizing and planning treatment in ways that make it work better, you get a little bit better. And that's how you learn. Really, you don't learn much from the stuff that goes real well. Right. So that's easy. I would say, you can teach a nutless monkey to cut a prep if you give it enough time, right?
Yeah.
But the differentiation is your thought process. Can you think through everything that you're seeing in someone's mouth? We have a great exercise that I do in the global diagnosis platform. Sometimes I just put a picture of some teeth up. What do you see? And sometimes there's a lot of obvious degeneration in these cases, and sometimes there's not. But if you start looking and you start picking it apart, your brain starts to think, well, what about this? And what about that? And what about that? And what you said earlier was correct, is that, you notice more failures as you get older just because you're noticing them. You're not blowing them off. You're not just ignoring the fact that they happen. You go, well, what my curious brain says, why is that happening? What can I do to change it? But looking at just a picture of the mouth, sometimes a picture of some teeth, you could spend a half an hour sometimes just digging down into very subtle things that have meaning. I often tell people, look at patterns of wear. For example, you had Jim McKee on not too long ago, I think, too.
Yeah.
And Jim talks about if you got a clicking joint, you have a displaced disc. That's it. At some level, it's displaced. What you have to figure out is what's the level of displacement, what's the impact of that, how is it affecting this person? Well, if that happens, then how does that manifest itself on the teeth? If you've got worn posterior teeth and the bicuspids aren't worn at all, well, why is that? This isn't a chewing pattern, because if it was a pattern, it would be worn everywhere. And sometimes you'll have worn anterior teeth and not worn posterior teeth. Well, why is that? Sometimes you'll have worn teeth that are really short in the posterior. Well, why is that? Well, you could have lost dimension at the joint level. So you have to be curious and pay attention to these outcomes and realize that you'll have failures. They don't have to be catastrophic failures, but just pay attention to the little nuances that happen so that you can be a little bit better, a little bit better, a little bit better. Excellence is improving just a little each day.
I love it. A lot of the people that we meet in the ACT dental community, they have different core values. And I hear this one a lot: better today than yesterday, or better tomorrow than today, which really speaks to that whole progress, not perfection. Remember, we're human beings working on human beings, working with human beings. And so Barrett Straub, who is my partner here, he's so good at saying, hey, listen, remember, these are all humans. Don't expect the unexpectable, all right. So it's so good. And then a big piece of this, Jim, which I love, this might be my favorite one, is that you said you really have to define what success means for you. Now, I'll tell you that one is hard because you have these pressures from what you see about success or what you feel or what you've heard. So tell me what that means. What does that mean? You have to define success.
Well, everyone's definition is different. And I'm sure this is a cross-cultural problem, but it's very evident in dentistry to me that people try to aspire to be something that is sometimes not achievable for them only because they're not that person. I thought I was going to be Pete Dawson, and I'm not going to be Pete Dawson. Yeah, there's no way. Pete Dawson's going to be Pete Dawson. We we even talk about it in terms of sometimes how we name stuff in dentistry. It's always fun because I teach occlusion. I teach the occlusion workshop at Spear now. I'm visiting faculty down there still. And I teach the occlusion workshop down there, and they go, "What kind of splint do you use?" I go, "I know. What's the patient's name?" "Well, it's Marjorie." I said, "I'm going to use Marjorie's splint." I said, "You don't use a Tanner? You don't use a Gelb?" I said, "No, I don't know what those are. Because it's all fluid. I'm going to make Marjorie a splint that's Marjorie's. That's right for her. That's what I'm going to use." But we tend to to focus on, we got to be like this, or if we use this, and or we're going to be like this person, then that defines success. Or I've got to be able to do $2 million a year right now, or I've got to do these things that are just sometimes are ridiculous, and create enormous amounts of pressure on people that it really doesn't have to be that way. If you can't enjoy the ride, then something's going. So you need to step back and say, what am I doing here, and is it really fitting with my core values, and how do I define success for me? Some people define it in terms of monetary gain, and certainly we have to have a successful, profitable practice, to have that comfort and be able to provide for our families and provide for ourselves. Some people will define it as more freedom. Some will define it as the ability to help others, the ability to give back. It's all their why. Your why is, if you determine your why, then your success can be an outcome of the why, not the opposite way around.
Yeah.
There's one saying that really sticks with me too, and I don't know where I heard it. They said, if you're always focused on the means, you're going to miss out on the meaning. So if you're always focused on the means to get to 100,000 a month, or 150,000, whatever it is, and you're always focused on the dollars, you're always focused on the profit, you're always focused on the production, you miss out on the meaning of it. What's the meaning? What brings meaning and joy to you? Again, write the book you want to write, not the crap that has to sell. And anyone can do that. I mean, if with enough intention, anyone can do that. And I say that because I believe that whatever your definition of success is, whatever you define it, it always takes three things. It always takes hard work, some luck, and some talent.
In that order, right?
In that order.
Explain that.
Yeah, because without the hard work, nothing happens, right? I love, I'm a little controversial here, but I love people that say, "Oh, if you love what you do, you'll never work a day in your life." Bullshit. That's just crap. It's hard work. It's hard enough and doing the things you need to do, and taking the CE you need to take, and changing your curriculum, and changing your mindset, and changing your protocol. Mindset first, obviously, to do something that's extraordinary, do something that's different, do something that's rewarding for you in terms of your values. So don't think it's going to be just all fun and games. That's irrational. It doesn't happen that way. Anything we're doing takes hard work. It takes the ability to absorb that failure we talked about, and learn from it and move to the next level. And it takes some luck. Sometimes things just fall together in the right place at the right time. But that doesn't really happen unless you're putting yourself out there. If you're not in the game, you're not going to get those opportunities where those opportunities meet your development. That's lucky enough to kind of take you to this. If I didn't go and bug Pete Dawson, it was lucky that I met him, right? But if I didn't go and put myself there, and put myself in his courses, and put myself in his workshops, and really challenge him on his thinking too, I wouldn't have had that luck to be able to be around him. Have those lucky turns of event. Luck is some kind of outcome, but it takes some luck. Sometimes you're in the right place at the right time, and it all works out.
Yeah. Sometimes the world just gives the benefit of the doubt to the person who's showing up regularly. So you showing up in those courses, I mean, showing up at any of them and being up front, being early to any course, shaking somebody's hand, writing a letter, Writing a letter was always like my way to say, hey, thank you. Number one. Number two, I was there. I was paying attention.
Right.
And many speakers, I won't mention who they were, but if you listen to the podcast, I would actually write notes, type them up, and send them to them saying, hey, listen, I was paying attention. I'm not one of those people who's like trying to glean. I have a couple questions. And they'd be like, whoa, you heard that in my lecture? And I heard, but here's my point. You get lucky by doing that. You get the benefit of the doubt. And these people know other people who go, you know what? You have to meet my friend. My friend would really enjoy the conversation with you. And it saves you so much time. Other things that happen with what you're talking about, that hard work of showing up. Yes, it is hard to get on a plane, go away. Yes, it is hard to spend the money and do it. Yes, it is hard to do it. But when you're doing it, like, you do get luckier. You sit next to somebody in one of these courses and they go, hey, I got a form for that. I've been using it. And they give it to you and you're like, oh my gosh, I've been working on this for 10 years.
Right.
So you can call that whatever you want, but that's not something I would ever figure out myself. That was, I got lucky sitting next to somebody because you're in the arena. Absolutely. Don't you agree?
Oh, absolutely. Yeah. It's all those serendipitous activities that all of a sudden you realize that there's a power in here. There's an energy in here. There's an energy in the universe that you're tapping into. And I think that's kind of what we think about in terms of luck. It's when those energies kind of coalesce. I mean, we're all just bundles of energy. That's basically what we are, right? And so, if you put it out there, then these opportunities are going to present themselves. And then when they do, you have to try to be aware of them and take advantage of them and go back and do the hard work it takes, like you were saying, to take advantage of them, right. To somebody. The great thing about being a teacher is, and I learned from other teachers, great teachers are the ones who recognize something in you that you don't see in yourself necessarily. And I was the recipient of that. And so now I try to be the purveyor of that. But I'm the purveyor of that to the people who really want to learn, right, who really are taking an active role. And we see that on our global diagnosis platform. We've got some rock star people on there, some of which you're going to be interviewing. And to watch them develop, I mean, it's just remarkable. But it was the same thing I did, right? I mean, it was the same thing you did, is put yourself in that position. Talent is important. I mean, I would never dunk a basketball like a college player or an NBA player. There's no way I could do that, only on a ladder. So there are things that require some level of talent. But in dentistry, you can develop talent.
Right. You
really can.
Yes.
Now, you've got to realize also that everyone has gifts and strengths and certain subsets of strengths that they have that are unique to them. I'm a big picture guy. I'm a philosophical thinker. So I like, my talent is to kind of put big things together and put the ideas together and try to make them all merge and to help people see the connections in between things. Bill is more of an organization guy and a step line. So I think of the idea and I throw it out there and I go, you people figure out how to do it, right? Do you know anybody like that?
What are you saying? I don't know what you're saying. Yes, I do. Very much so.
So we need the people around us to make our talent work. But everybody has their own innate talent, but you can develop that. If you don't have a talent in something, if you're self-aware, then you can develop those sort of things. And and that's an important thing as well. I mean, you've got it. That self-awareness is really important to realize. This is who I am. This is where I want my life to look like. How I want to manifest it. What do I want them to say at the eulogy?
Right.
Nobody at my eulogy. I don't want anybody to say in my eulogy, oh, he did $1 million in 1980 and he did $2 million. No, that doesn't matter. He made a difference in somebody's life. He helped somebody learn something. He helped somebody move to the next level. He made the profession a little bit better by teaching these other people along the way. And that's what really matters. Because what are you doing every day to get out of your own head and help somebody else? Because if you're helping somebody else and you're helping somebody else grow and develop, you can't be in your own head. And that's where we get in trouble, when we're in our own head.
It creates a lot of significance and good feeling when you leave it better than you found it. So,
Absolutely.
Jim, I want you to talk about how, I mean, you're truly an example of somebody who's given back and doing that. And I want you to talk about global diagnosis and the symposium coming up. But before we do that, any last thoughts you have on everything works until it doesn't?
Well, I think it's important just to keep that in the back of your mind. You know, that it's truly is one of those truisms that that we all have to manifest, in our own mindset, that, always don't try to hit the target perfectly every time. Just keep aiming and keep trying and push through. There are times, even this week, I had to push through some stuff that was tough emotionally, coming to the end of clinical practice, right? If I'm going to teach, I'm going to consult, so I'll be active. But coming to the end of that journey, it's the appropriate time. Don't get me wrong, but it's an emotional struggle. But you got to push through. There are bigger things ahead. There are better things ahead for everyone, and so you've got to just stay focused, work through the difficult times, take it easy on yourself. Yeah.
I love it. Love it. And Jim,
don't should on yourself. Like I should
don't should on yourself.
Should be making this,
Yeah. And now you guys have heard me say this, but I love these guys. Jim Otten and Bill Robbins have created something very special, but it's gone bigger than you, more significant than you. It's called Global Diagnosis Education. Can you talk about that? What is it?
So, the global diagnosis protocol is a way that Bill Robbins and Jeff Rouse created to simplify the restorative, interdisciplinary restorative technique and treatment planning. And Bill has done a remarkable job of carrying that forward. It's all based on facially generative treatment plan, Pankey Dawson philosophy, Coyce philosophy, all that stuff is built, it's all built on the same similar principles that all of those great teachers have taught us over the years, but it simplifies the complex. I've added and added more of the occlusion and airway components to it to try to simplify that thought process as well. But that's the technical part. The really cool part is the mentorship part. So when we started doing this, we thought, everybody needs all this information. They don't need the information as much as they just need the support and somebody to say, hey, I'm there, I got your back, I got you on this. And so there's not a day that goes by that I don't get a text or a call from somebody that says, hey, can you help me with this? And the answer is always yes. We sure can. Because it doesn't, and these are all people, most of the people on the platform, interestingly enough, have been to many of these institutions, but they come here to get the continuum of feedback and that continuum of support that's necessary to help them implement in their practice. Because you're not implementing, it's all just entertainment. So I'm just so lucky to have Bill as a partner. We have a great time together. He's just one of the best people on the planet, and you couldn't have a better business partner and a better partner to work with to help move these people forward. And now we're creating, we're seeing people develop as teachers and lecturers and going to be some new leaders in dentistry. So it's super exciting, and then being able to team up with some of the people you work with and you're helping them implement the stuff into their practice and everything. It's just been awesome. So I'm going to miss clinical dentistry to some degree, and then some degree I'm not. This is super fun.
I'll say this because I have intimate knowledge. You guys are incredible clinicians, some of the best in the world, but even better human beings. So if you're looking for an opportunity, and we hear this all the time, I can't find a mentor. There's no mentors out there. There are some mentors right here, right in front of you. All you got to do is show up. And it's amazing how they'll care for you.
I know you'll put it in the show notes and everything too, but if they're interested in joining, write to us and at global diagnosis info@gmail.com. We'll put it in the show notes. Do that if you're interested in learning more about it. I'm happy to answer questions. If you're listening to the podcast and you put podcast in the subject line, we'll give you a discount on signing up, even just to help you get in the door.
Awesome.
So, just to give you a little incentive to take action, but take action. That's the most important thing. Take action. Do something. Don't just talk about it. Do it. I mean, too many times people spend hundreds of thousands of dollars on education that they don't implement it.
Right.
Put
yeah. And you guys also have the symposium coming up. Talk about the Global Diagnosis Symposium. What is it?
Well, this is a chance where we all, most of global diagnosis education is online, and it's fun because we're trying to build community online, which is great. You guys have done this too, and you've been a wonderful example of how to do it. But we get together once a year in Milwaukee at ACT World headquarters, and we put on a symposium mostly about relationships and some about dentistry, but mostly about relationships. So we take this kind of topic we're talking about today, and we talk about the emotional and behavioral components of dentistry and how important that is. And this year, Josh Austin's going to be there, and Josh is a wonderful speaker on the behavioral aspects and the emotional components and the difficulties we all struggle with. Sometimes going through these feelings of depression and anxiety. He's been through it. I've been through it. Everybody's been through it.
Yep.
Everybody that you think is the most stable dentist on the planet, nope. If they say they hadn't been through it, they're lying or they're totally self-unaware. One of the two. Everybody's been through it. And so if we talk about these things and we talk about it openly, then we can help each other, support through it. And we do it on the platform as well. But Josh is going to be there. He's going to talk about a lot of that. He's also going to talk about implementing digital dentistry. He's a smart young guy, boy. I wish I was as smart as he was when I was his age, if he is. And then you're going to speak, and Bill and I are going to speak as well, just to kind of keep everything, wrap it all up together. But it's an exciting time. A couple of days in Milwaukee. We had a blast last year. Everybody was there, loved it. We're going to have a great dinner out, some receptions. So if we'll get the information out to everybody, but come, show up.
Absolutely. Yeah, I'm going to encourage you, if you're listening, you got to show up. It's awesome. And just like we've always done, the notes for this particular podcast, everything that we've shared and Jim shared, you're going to see those in the notes. So if you're not taking notes, this is our jam around here. We take notes for you.
Yeah.
You can flip up to the show notes and you're going to see links to everything that Jim has shared, not only global diagnosis. We're also going to put a link in there for Global Diagnosis Symposium. And I'm going to highly encourage you check it out. So Jim, thanks for being on, brother.
Hey, thanks for having me, man. It just made my day. Really did.
Well,
as usual.
Well, we're going to do a lot of this, and you're going to take me on one of those food and wine trips to Italy that you guys go on.
Yeah, we didn't cover that in the content here, but we will another time.
We're going to save that for another time because you guys know how to craft an incredible experience. So,
well, we did it in our practice for so many years, but do it throughout your whole life. Craft a great experience not only in your practice but in your life as well. Enjoy the ride. Right? Okay.
Absolutely. Well, stick around, my friend, so we can say goodbye to everybody else. But thank you guys for listening to the Best Practices Show. Hey, if you enjoyed today, just keep doing us a favor, as a lot of you are. Just share this with your friends because we're going to keep bringing it. Great educators with great information to help you create a better practice and a better life. So until you guys see us next time, or we hear from you next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.